Hi everyone, Dr. Ken Redcross here. Now, you know what my passion is. It's the patient-doctor bond. And I love that because that's something that unites all of us. Whether I was practicing here in New York in the Harlem area in the beginning of my career or out in California, there's something that unites all of us, and dare I say, really all around the world. We all want to make sure that we have a good patient-doctor relationship. But how do we do that? Well, I've learned through some of my challenges of healthcare as well, as a patient on that side of the stethoscope as well, is that we all really want four things. We want trust, respect, empathy, and communication with our doctor. Hence, the reason why I wrote Bond. I realized that as a physician, there were maybe some things that I didn't really understand as well until I was a patient on the other side of the stethoscope. Is that I also, with my doctor, wanted to feel like I could trust, that we can respect one another, that he or she cared, had empathy for my situations, and that we could actually communicate. Fancy that, right? Which is hard to do when you're rushed in that 7.5 minute average. And so when I recognized what some of the things that I wanted as a doctor and then a patient, I figured out a lot of you probably wanted the same, and I was blessed enough that it was true. I got a lot of wonderful feedback over the years since I wrote Bond, because here we're able to talk about why trust, respect, empathy, and communication are so important. Also with a few vignettes as well, some behind the curtain sort of interactions that I had with patients that maybe you'll see in yourself. And so that was the reason why I wrote Bond many years ago. So then I started to recognize I got so much good feedback. I said, well, what can I do to kind of take it up a notch for you as well? And for myself, as we are all patients. That's when I decided to write the 15-minute Bond Blueprint. Well, it's just like a blueprint is supposed to do. It kind of lays the groundwork, right? For us to have this beautiful, beautiful building, our beautiful temple, which is all of us. All of our bodies are beautiful temples. And so the Bond Blueprint is there to kind of lay that groundwork step by step. You know, here in medicine, we always say our visits are 15 minutes for the follow-ups. We all know it's not really 15 minutes. But the point is, the purpose of this book was to go minute by minute for us to figure out what should be taking place. How can we further optimize our relationships? So I also thought it was valuable to include what we call these Bond Blueprint prep sheets. The prep sheets are before you get to the visit, so when you get to the visit, you know what's going on, and then even some debrief for the post-visit to see how did that interaction go. So what I tried to create here, everyone, with the Bond series was a way to understand how you should be feeling with your doctor or provider, how you should feel the trust, respect, empathy, and communication are there for you and during your healthcare journey. And then the other book was to kind of take it step by step for you to understand going to the doctor isn't just something to do and run and go in and go out. It needs to be a strategy. There needs to be a plan to make sure we can increase our life journey. So once again, I hope all of this is as valuable to all of my patients, and it will be the same for you and your family. Remember, we are all united by one thing. No matter what we do, we're all going to be a patient at some point. I say, why not have a fabulous relationship with your doctor while you have that? And then why not know how to navigate it as well? So once again, thanks for allowing me to share my passion with you. More importantly, I hope it helps you. And please, I mean it, reach out, let me know how I can help as well. Take care and be well.